All right, so it looks like I am recording and I'm going ahead and get us started. Can I do this and it moves? Awesome. Okay. No, I was doing this earlier. I tried to. Oh, I'll just do it that way. Okay. Hi, Professor. Hi, Heather. Whoever is viewing this. Just wanted to do my medical family therapy project presentation. So, first slide, starting off with the evolution of medical family therapy. Let me move myself so I can see where I put everything. I don't know if you can tell on your end, but all right. Medical family therapy, MedFT is what's going to be used a lot in this presentation. Emerged in the late 1970s, early 1980s to address the gap in the healthcare system between biological and psychosocial health. Medical family therapy emerged from the discipline of family therapy pioneers. In family therapy, succeeded in applying general systems theory, cybernetics, and the idea that relationships are central to human health and well-being. And kind of what I'd kind of gathered throughout my research and everything, they were trying to bridge that gap. They wanted to basically bring the disciplines of family therapy and the disciplines of medical practice and combine those to bridge the gap because they were seeing from what I gather, just a lack of interconnectedness when it comes to serving the patients as far as bedside manner, bedside care, and just overall approach to treatment. So they just married both theories from what I how I gather and process it. One quote that I wanted to include, which stuck out to me, and it kind of ties in, my enjoyment of this course, enjoyment of the class, and everything, from John Guyman, if I'm pronouncing that correctly, who is known as a pioneer in the field of family medicine, wrote the following. It is axiomatic that the specialty of family practice is involved in the comprehensive ongoing care of individual patients and their families, and that the knowledge and skills required by the family physician include a broad range of clinical competencies. It is likewise axiomatic that the family is the basic unit of care in family practice, but involved herein is a profound conceptual shift extending well beyond the care of the whole patient to the care of the family, not just the individual as the patient. Although this point is a part of the everyday language of developing discipline of family medicine, a gap usually exists between this conceptual goal and actual practice, including teaching practices with intended commitment to this goal. It was very wordy of a quote, yes. But I think especially when specifically focusing on that whole patient, kind of looking what we kind of talk about in this class and what I have mentioned in some slides and that you'll see, not just focusing on the patient themselves and making their world, their treatment, just what's in the room, looking at the patient as far as the holistic perspective, working with the families, working with the physicians, really trying to bring in and consult and bring about all the types of support to treat the patient best and also just be there for them in support of whatever medical illness they might be experiencing in the hospital or whatever medical setting is that we're in, and just really focusing the shift on that holistic perspective. This is how I interpreted the quote. That's why I thought it would be good to include it. But I just love the idea of looking at the whole patient because it just reminds me of the holistic perspective that we talk about so much in this course. So mention a slide on the four world view. Most of my slides are just kind of just few words, or at least I try to from here on out, and just expand on them from here. In reference to CJ Peak's three world model, with addition of training, this model suggests that in order to impact healthcare, worlds, must be addressed simultaneously. From the clinical aspect, what do we do? Operational, how do we do it and support it? Financial, what is the return on investment and cost? And training, how med FTs develop clinically. I think it's really important just to focus on each one of those, and they can be their own conversation and presentation, to be honest with you. Clinical, what do we do? Being able to express the role, how we bridge the gap as medical family therapists, and being able to serve the client, serve the patient and their family and the physicians on their end, kind of being that middleman. I say that a lot in my discussion posts, and I'm probably say it a few times in this presentation, being able to speak that language of medical terms, speak that language of psychoeducation and being of the therapeutic process. I think it's just so cool, like being able to learn all this and what they do, and just be able to, this is how the approach would be if it were to be interpreted and utilized in a clinical setting. Operational, how do we do it and support it? Really seeing at the gist of it what the roles and the functions are. I love that MedFTs can be in hospitals, community centers, schools, and everything like that. it just comes down to a lot of times, and we'll move on to it, financial. A lot of times it comes down to resources, depending on the socioeconomic status of the city that you may be in, whether or not they could support the function of a med FT and all the great things they have to offer. Financial, of course, we want to make sure there's return on investment, and cost does matter. I mean, as we talk about insurances and talk about all those issues that play a part in psychotherapeutic treatment, medical family therapy, and course includes insurances regarding the medical end as far as hospitals goes, if we're using that as the main example. So being able to consider the financial world view in itself is sometimes the biggest, if not the biggest, challenge of them all. And then training, how MedFTs develop clinically, that's what it comes down to. You could have all the funding and great, support in the world, but you want there to be good at med FTs and be able to treat patients, treat the hospital, and just do right by the role that they play in these settings. Appropriate MedFT screening protocol. So the essential task in meeting with family members as a medical family therapist for the first time in family assessment is to evaluate and assess their functioning in the context of understanding their problem. Family assessment is the first step in determining both the need for further interventions and the specific areas of the family life that might need to be addressed. Family assessment should, excuse me, just moving myself so I can read. Family assessment should focus on adjustments related to the diagnosis of medical illness. Excuse me, clarification of treatment options, collaborations, and carrying out the treatment plan. A proper assessment should also identify family strengths. Kind of mentioning as earlier, it's not about just the patient. While the patient may be the main focus, you want to assess the family. You want to be able to do the proper screening protocols that to see what are the strains, what issue are we facing, what issue are we encountering, how can we bring from a systemic perspective, holistic perspective in with the medical terminology and provide context to help them understand what's going on and what's needed as far as the patient's need. So many families can benefit this in the hospital setting. I could speak to this from my own personal experience, just family wise. I would have loved someone to have gone through this protocol and this process with us, just to know what we're dealing with, how certain family members of mine could have benefited from this. It's an awesome process as far as if it's done right with respect. Workflow of positive screen, just kind of breaking this down. Family relational factors that have a protective effect on illness. We have good communication, adaptability, clear rules, mutual support, open expression of appreciation, commitment to the family, spending time together, good problem solving skills, and extra familiar social connections. All these factors bringing in, this is what could be a protective effect by means of positive support that can make the difference in treatment as far as how the patient might be viewing themselves, viewing their condition, whatever they're experiencing in the hospital, and just know to have these factors in their corner. This could be the one of the big, huge factors that allows them to push through, build their self-esteem, build their hopes that, this is just right now. I have support on the other end and I'm going to make it through this. So kind of taking these into context. The three main goals when conducting a family assessment as a MedFT. The first is to orient the family to interview process and to establish an open and collaborative relationship with the family. You want them to trust you. You want them to be on the side of, being able to support the patient. Second goal is to have family members identify all current problems in the family, including the problems that precipitated the meeting. Maybe you kind of understand why myself, if I'm using myself as an example, why I needed to be called in, what's going on, how can I help. The third goal is to identify the family's transactional style that appears to be related to the family's functioning. We might have been doing something a certain way all these years, and now we're faced with a really stressful, really high anxiety situation in a hospital setting. We might need to go a different approach as far as how we communicate, how we talk about this, how we consult with family members, how we discuss things with the patients. It could be any which way, but being able to bring that conversation to the floor, to the session, wherever that may be in the hospital setting, could just be an awesome opportunity for growth and understanding as far as moving forward. Useful behavioral health interventions. Mindfulness based cognitive therapy is a treatment designed to help those who suffer from ongoing episodes of depression and those who struggle with suffer from chronic unhappiness. This could be spiked in the hospital setting depending on what they're experiencing. I mean, for example, my grandfather at one point was in the hospital for a year and a half. Depression spiked. He didn't know what was on the other end, really low, really down. So being able to go through some of those mindful based cognitive therapy practices could have been so beneficial, and so many patients could benefit from this right now. Solution focused brief therapy, good evidence based therapy, a short resource oriented and goal focused approach to therapy that helps individuals change by constructing solutions. Many times it could be out of their hands what happens in the hospital, but at least as far as certain small treatment goals, I mean, how can we incorporate mindfulness practices? How can we do maybe small exercises that we can, or what we're able to do in the hospital, or even just to check in, something that there's goals, something that we accomplish while we're going through such a stressful and anxious time in the hospital, I think is so important, especially with being a medical family therapist in that situation. Interpersonal psychotherapy, a brief, very structured type of approach, helps one deal with interpersonal issues that could cause them problems in terms of their medical health, really divulging and going into what's going on for them, their process, what's their narrative in the moment of where this situation, this illness might go to. So just being able to talk with them about that would be huge. Let's keep it going. So, treatment for individual versus family. While individual work with a medical family therapist may concentrate on a person's personal struggle while in a hospital setting, the purpose of treating the family is to look outside an individual and have a holistic approach during the treatment of the problem. Being able to look at the family as a whole, the patient as a whole, and what factors are contributing to the stress, the anxiety, and things like that. And for families dealing with chronic illness or disability, relations with healthcare professionals, insurance providers, and government agencies are often among the most stressful aspects of the situation. Even listing those off, I get stressed, and then families that have no knowledge and they have to learn all this on the fly. It's not fun at all. Medical family therapists provide a working knowledge of these healthcare and community systems in order to help families. I meant to finish it off. Help families process the pain or process the stress that's going through, move forward as far as what they need, and just be able to have conversation with each other, especially if they've been through such repeated cycles of stress, anxiousness, depression, grief with their family or family members that have been in the hospital. And it's just been a whirlwind for everyone. And just the structure of the family system is just out of whack. So bringing some groundful mindfulness to that. And then there's references. These are my references that I use. They're noted in a little text box below each slide. Um, and that is the end of the slideshow. I really enjoyed this. I hope I did this correctly. I wanted to make sure I recorded. I recorded it using Zoom, so this is kind of like my way of letting you know how I did this. Um, yeah, I believe I just messaged too as well, just trying to get it posted and set up on the discussion post. So I'll go ahead and do that. But yeah, this is an awesome class, Professor. If you're watching this, thank you for all the information. Heather, thank you for all that you've done as far as our grades, as far as looking and helping. Huge help. Really enjoyed this course. Hopefully I did this right. So have a great rest of the week, and yeah, have a good summer. All right, let's see if I can stop recording. All right, and then I'll stop. All right, bye.